Hi, my name is Dr Tasha and I'm a breast cancer surgeon. When people in the public domain talk about their health, whether it's a health scare or a cancer diagnosis, the public respond in different ways. But when Angelina Jolie broke the news about how she underwent a risk-reducing mastectomy or preventative mastectomy, the effect was very different. The phrase the Angelina Jolie effect was coined and her story impacted so many lives. In this video, I'm going to be recounting Angelina Jolie's story through the material that is available to the public, and we'll go through the reasons why Angelina Jolie decided to have the surgery. Angelina Jolie is an actress, filmmaker, and humanitarian. She won an Academy Award for Best Supporting Actress for her 1999 drama Girl Interrupted, and was nominated for an Academy Award for Best Actress for the film Changeling in 2008. In February 2013, Angelina Jolie revealed that at the age of 37, she had a bilateral risk-reducing mastectomy with an implant-based reconstruction. So, why did Angelina Jolie decide to have a preventative or risk-reducing mastectomy? Angelina Jolie has a strong history of breast cancer in her family. Her mother died having had ovarian and breast cancer at 56. Her grandmother died of ovarian cancer, and her aunt, who also carried the BRCA1 gene mutation, died of breast cancer 3 months after Angelina Jolie's operation. Because of this family history, Angelina Jolie got tested and was subsequently also found to be a carrier of the BRCA1 gene mutation. The mutation or abnormality in this gene increases your risk of developing both breast cancer as well as ovarian cancer. So, what is the BRCA gene? Well, we all actually have the BRCA1 and BRCA2 genes. The name BRCA is an abbreviation for breast cancer gene. Despite the name, these genes actually do not cause breast cancer. It actually is the reverse. BRCA genes are known as tumor suppressor genes, and their job is actually to prevent cancer from happening by repairing DNA damage that may otherwise cause cancer. So when people say they have the BRCA gene or they carry the BRCA gene, what that actually means is that they carry a mutation or alteration in the BRCA gene. This mutation affects how the gene works, making its ability to suppress or stop cancer from developing less effectively. So that's why when you have a mutation either in the BRCA1 or 2 gene, that person has an increased risk of developing breast and ovarian cancer. Angelina Jolie's doctors estimated that she had an 87% chance of developing breast cancer and a 50% chance of developing ovarian cancer. 2 years after her mastectomy, she had her ovaries and fallopian tubes removed to reduce the risk of her developing ovarian cancer. Once I knew that this was my reality, I decided to be proactive and to minimize the risk as much as I could. I made a decision to have a preventative double mastectomy, Angelina Jolie wrote in the New York Times. I started with the breast as my risk of breast cancer is higher than my risk of ovarian cancer, and the surgery is more complex. Angelina Jolie was very open about her surgery and experience. She also described her decision to undergo preventative surgery as a proactive measure for the sake of her 6 children. Angelina Jolie's story was dubbed the Angelina Effect by a Time cover story. Her experience resonated far and wide, and her decision to share her story was praised by public figures and health campaigners. The number of referrals for BRCA gene testing actually doubled in the UK, and it increased significantly in other parts of the world. Angelina Jolie's message appeared to have reached those most at risk and is long-lasting. According to Angelina Jolie, the choice to get a mastectomy was empowering. On a personal note, I do not feel any less of a woman. I feel empowered that I made a strong choice that in no way diminishes my femininity, she wrote. That was Angelina Jolie's story. Do hit subscribe if you want to learn more about breast cancer and health, and also so you don't miss the next episode. In the meantime, take care, and I'll see you in the next one.